This is Chelsea for VETT 220, Test 15, which is a canine exam. And we're going to go ahead and assess our patient's gait and her body condition. Okay, so her gait looks good and her body condition score is lean to thin, so I would give her a 4 to 5. And then we're going to go ahead and get on the scale here. Weight. Okay, and her weight is 73 pounds. So we're going to head to the back and do her exam. Okay, so continuing on with our canine exam, I have my assistant restraining down here on the floor with patient Misha. And we're going to go ahead and do the head to toe exam. So, this back a bit. There we go. Okay, so just looking at her before, her body condition is lean and she's a 4 to 5. You can palpate ribs and she has a nice waist. I'm going to start with the head here. Take a look at the nose. It's nice and wet. Eyes look good. Right eye looks good. Left eye looks a little weepy. Okay. Looking at mucous membrane color and CRT. It's less than 2 seconds, nice pink and moist. Dentition is normal, no tartar, no gingivitis. Tongue looks good. Palpating the structures of the head, no swollen lymph nodes here in the mandibular or the prescaps. Okay, that looks normal. I'm going to go ahead and get a heart rate. Okay, so I listened for 15 seconds and our heart rate was 15. So 15 times 4 is 60, so she has a heart rate of 60 right now. I was listening on this right side over the tricuspid valve and I got a nice clear listen. I'm going to go ahead and check the front feet. Toenails look good, nothing broken. Paw pads look normal as well as the carpal pad. Checking range of motion. Right front looks normal. Gonna go to left front. Same thing. Toenails look normal. Paw pads look normal as well as carpal pad. And then checking range of motion. Appears normal, as shoulders appear normal as well. I'm going to go ahead and listen to the lungs.
This dog doesn't need any restraint.
Yeah. Okay, respiratory rate is 16. All lung fields oscillate normal, so cranial and caudal and front, middle, and back, all of those lung lobes sound normal. We go to the ears. Right ear is normal. Left ear and pinna also normal. Okay, moving on to palpating the abdomen. So we're going to be feeling kidneys right now. Right kidney palpates normal. The left kidney also normal. You feel cranial abdomen, stomach, pancreas, spleen, liver. her. Abdomen's not tender, also palpates normal. And now the caudal abdomen, intestines, and colon and bladder is empty. I'm going to go ahead and feel more lymph nodes here. So popliteal. And I should be able to feel the inguinal. And I cannot. So we're going to assess the hind leg here. Paw pad normal, toenails all intact. And check range of motion. This one's a little tight, which is the right hind. Checking the left hind. Paw pads. Good, toenails all intact. And range of motion. And that is within normal limits. I'm going to go ahead and check genitourinary tract. Rectum looks normal. And vulva and surrounding structures are normal. I'm going to go ahead and get her tip with our rectal thermometer. Okay, and the temp is 100.9. Okay, last thing we're going to get is a pulse. While we're listening to the heart, up over the tricuspid valve here, we're going to feel the femoral arteries. And for every heartbeat you hear, you should feel a pulse. I do on that side, as well as that side. So I'm going to count for 15 seconds. Okay, and the heart rate's still around 60. Okay, and that concludes our canine exam.